Please welcome to the stage ABC News and NPR political commentator Cokie Roberts.
Good morning. Well, this is a great event, and I know all of you are excited to be here. I was just reading that on this date in 1793, George Washington laid the cornerstone of the Capitol. I wonder what he would think today. But unlike most people in this town, you all are here to work together and try to find common ground, and that is a very unusual situation. But it's around a program that is really incredibly successful after 15 years. We never see these kinds of numbers for government programs, as we see in the report that was commissioned for this event today. I mean, 81% of seniors say it's good value. Seniors never say anything's a good value, right? And I'm a senior, I know. And 91% say it's convenient to use. Again, what government program do you ever hear anybody say it's convenient to use? And 84% say no hassle. These are just remarkable numbers. 83% believe it's very important to have a variety of plans to compare and choose from. So that's an indication of things to think about as we go forward, that is something that is part of the program, but that needs to remain very much part of the program. And there are many challenges, as you well know, in terms of cost and access and all of that. That we'll be talking about in our panels today, which are really great panels of really interesting people. And there'll be a certain trip down memory lane for what happened 15 years ago and how remarkable it is that this happened at all. So it's going to be a great day. And it's a day that begins appropriately with Sandra Raymond, the CEO of the Lupus Foundation of America. She has been so incredibly active in putting this organization together and bringing people together and fighting for the patients. So please join me in welcoming Sandra Raymond.
Well, good sunny morning. Is it raining out there? Good morning, everyone, and welcome to the MapRx Summit. 15 years of Part D, celebrating success, building toward the future. As you know, I'm Sandra Raymond, CEO of the Lupus Foundation of America, and I could not be more proud and excited to be here for this important event. Medicare access for patients' treatments, MapRx, is a coalition of more than 55 patient, family caregiver, and health professional organizations committed to safeguarding the well-being of patients with chronic diseases and disabilities who rely on Medicare's prescription drug coverage, Medicare Part D. At this moment, I'd really like to take just a little bit of time to recognize the MapRx member organizations in the room and ask that they stand now as we show appreciation for their work to protect and strengthen Medicare Part D. And should any organization in the room today wish to become a member of the coalition, see me later. So please stand. MapRx members, please stand. So the Lupus Foundation of America founded MapRx in 2005 after Part D was created by the passage of the Medicare Modernization Act. MapRx members represent every segment of the Medicare beneficiaries, and they join together to advocate on their behalf. As well, they collaborate with national and state policymakers to ensure all beneficiaries have access to the medicines that they need. Throughout the year, MapRx coalition advocates are big advocates for policies to sustain and strengthen what is one of the most successful and relied upon federal programs. So what do? Our activities include hosting educational briefings for lawmakers on Capitol Hill, conducting trainings for organizational staff working with enrollees, engaging CMS and members of Congress on key legislative and regulatory issues, commissioning reports that give us a better understanding of the impact of Part D and how it could be strengthened, and producing an annual open enrollment guide that helps people navigate enrollment so that they can pick the plan that best meets their needs. MapRx is guided by the idea, by the philosophy, that every Medicare Part D beneficiary should have timely, affordable access to the medicines they need to live a healthy life. You know, it's really easy to take Part D's success for granted. This marketplace has offered eligible seniors and those with serious and chronic conditions an avenue to access critical medications that were largely unavailable until the program launched in 2006. Part D beneficiaries have access to a wide range of medications across many therapeutic areas and classes, abundant plan options for enrollment, protections to minimize out-of-pocket costs and help ensure access to treatments. This truly is a unique partnership between commercial health plans and the federal government, and it has enjoyed enduring popularity among the tens of millions of beneficiaries who have enrolled in the program. So as we celebrate the 15th anniversary of Part D, 15 years, we see a program with a vibrant marketplace, robust enrollment, and wonderful plan offerings. Enrollment in Part D has more than doubled from 22.5 million in 2006 to nearly 44 million today. This represents 74% of all Medicare beneficiaries. In addition to its popularity among the Part D beneficiary population, the benefit does something else. It really improves patient health outcomes. There have been studies that conclude that this program has prevented further onset of diseases, prolonged survival rates, and reduced hospitalizations. And while there have been, over the years, some average premium fluctuation, overall, average premiums have been relatively stable. But a key hallmark, and I think most of you in this room know this, but a key hallmark of the Part D success story is that expenditures have consistently beaten initial projections for the program. So in the first 10 years of the program, total expenditures were $555.8 billion, with a B, less than originally projected. As someone who works with people with lupus every day who rely on Part D, I can say, truthfully say to you, that the biggest and most important success of the program is that it improves lives. People with lupus take, on average, 8 medications a day. And without these treatments, we would see an increase in the number of hospitalizations, worse outcomes, lower quality of life, and increased mortality due to the disease. The same could be said of so many other conditions. In short, Part D is saving and extending the lives of millions of Americans. While there have been several noteworthy successes for Part D since its launch, current challenges do persist. For beneficiaries who do not qualify for the low-income subsidy, several factors present increasing financial challenges. And these include, and you know them, specialty tiering, non-preferred drug cost sharing, the lack of an annual out-of-pocket maximum, and prices at the point of sale that do not reflect manufacturers' rebates and discounts. I'm going to repeat that, because that, I think, is very important for the consumer, that prices at the point of sale do not reflect manufacturer rebates and discounts. Additionally, beneficiaries may not have access to preferred access pharmacies that would offer relatively low cost sharing. If Congress does not take action in the next few months, the out-of-pocket maximum problem could worsen. The out-of-pocket threshold is expected to grow $1,250 between 2019 and 2020. This is a dynamic that people are referring to as the out-of-pocket cliff. Our panels today, who are going to be great, by the way, I'm very excited to hear the people on our panels. They're going to discuss these and other issues. So as you heard earlier and as you saw, we're joined here today by representatives of MapRx member organizations from across the country. Their work is really terrific, and I just, again, want to thank them for all that they do. I also hope that you'll take the time during breaks, go out into the entry foyer and visit the digital displays out there in the foyer. We've got Twitter walls again. We have tweets coming in for most of the day. And I want you to learn a little bit more about MapRx and the coalition members. So now, let's turn to the main event. We have an amazing agenda today. You're going to hear from advocates, experts, policymakers who have seen the life-saving impacts of Part D from the very inception until today. And of course, we are so honored to be joined by the man who made this program a reality, President George W. Bush. I look forward to celebrating the history of Part D with you, and we also look to the future.